Hi, welcome to the ins and outs of diagnosis on the journey with my Hana. And this is for ages 4 to 8. I'm Sandra Alexander, speech therapist, and also the mom of somebody with autism named David, who you'll hear about during the presentation a little bit. So what happens is that you suspect that your child might have autism. So what should you do? You're like, oh my God, this is looking a little strange to me. So you might worry, most parents will worry about their kid's development, right? But if you really think something's odd, do something. The first thing you should do is talk to your pediatrician and say, look, this is looking strange to me. Can you screen him? Now, if your pediatrician's not sure what to do or wants you to wait, but you want to go further, and I suggest you do, get a referral. You can get a referral for a general, well, first of all, ask for a general developmental screening. Your pediatrician should be able to do that. But you can also say, I want him looked at for autism. Could you get me a developmental pediatrician, which is a doctor who, is steeped in development and, really, really knows what to look for too. They're not a generalist. You can once again say, I want an autism screening. I want to, if nothing else, rule it out. If something else, it could be something else. And trust yourself. You know your child the best. Please trust yourself. Don't let your pediatrician say, let's wait, or you might hear, we can't do anything under 2, which is wrong. Children are diagnosed earlier and earlier. I have seen kids on my caseload who've been diagnosed at 18 months, for example. So please, do what you need to do. If you think your child, for example, is lining up toys, that's the only way he plays with toys, get them screened. Or in my experience clinically, for example, I always say, put a boy on the floor, give him a car. If he picks up that car and spends 2 hours spinning the wheels, lying on his side, you probably have autism. That's been my clinical experience, and that's not a specific test item. If your child's not playing appropriately with toys, it's, bingo, let's at least look, something else is going on. Could be something else, but check it out. So there are types of evaluations. There's screening tools and diagnostic tools, and we're going to delve into that. So screening tools are used to kind of guide you a little bit about, is this really autism? Could it be something else? So the people who administer those tools are generally your pediatrician. Speech therapists can do screenings for autism, so can physical therapists. School psychologists often do. Pediatricians will use what's called an ages and stages questionnaire, and they'll just say, fill us out while you're in the waiting room or something about your child. So there's also the communication and symbolic behavior scales, a parent's evaluation of developmental status called the PAEDS or the PEDS, a modified checklist for autism and toddlers, the MCHAT, and another screening tool for autism and toddlers, screening tool for autism and toddlers and young children, the STAT. So I'll talk a little bit more about these. Make sure that whoever's doing this knows what they're doing. If you're not sure they know how, ask them, have you given this before? Ask somebody else to do it. This is your child, you want the best. So don't be afraid. So feel comfortable about that. So the ASQ, this first one, Ages and Stages, is a parent questionnaire. It takes about 15 minutes. And they're going to be asking you questions about how your child talks, solves problems, how they're walking, that kind of thing. And they want to see what you see. The next test, which is the CSBS, is an in-depth instrument used for as a parent interview and also observation. So somebody's going to watch your child, look for how they're playing, communicating, that kind of thing, used up to 2-year-old level. The PEDS test is a screening for developmental behavior problems. And then they'll be like, okay, they'll get a score. Let's keep doing more evaluation, okay? It has 10 questions used from birth to 7 years, 11 months. The MCHAT is also a parent interview and is designed to identify children at risk for autism. It has 20 questions used between 16 months and 30 months. The STAT is a screening tool. It's interactive, and it consists of 12 activities for assessing play and communication, imitation skills, ranges from 24 to 36 months. So now that we get, let's say your child is screened and they get a score that says, oops, we need to look further, which is what happened in our case with my son. He was screened at Stanford, and then they're like, you need to come back. There was a 6-month waiting time between the screening and the further in-depth looking. Keep that in mind. There can be a long, drawn-out process here. So here are some of the tools, recommended by the CDC. And they're really, 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 really in depth. The people who administer this are very trained in it. So the first one is the Autism Diagnostic Observation Schedule, or the ADOS. It looks at, I think this is what my son had, but it's been a while, but I think this is what they gave him. So they're looking at how your child plays, doing imaginative play, communication, social communication. It's observation and interaction. It's 4 30-minute modules, so you're probably going to go back twice if you have a young child. They might not make it the whole time. It's from 12 months to adulthood. The next one, the ADIR, which is the Autism Diagnosis Interview Revised, is a standardized interview focusing on reciprocal or back and forth social interaction and communication. Looks for repetitive or restrictive stereotypical behavior, like if your child is only lining up toys, only spinning wheels on a car, that kind of thing. It's used for individuals with a mental age of 2 or above. They're considered the gold standard, both of the 2 tests I've told you about. They're accurate and reliable for diagnosing autism. You have to be trained to give these 2. I couldn't give these 2 clinically. I'm not trained in them. The next test, the Childhood Autism Rating Scale, or CARS-2, is a rating scale for normal, and you're going to just look at it. Is this normal looking, mild, moderate, severe? So you're rating in that way. It's 15 items and relates to symptomatology of autism, used for ages 6 years and under. The GARS consists of 56 items designed around the subscales of repetitive restrictive behaviors, social interaction, communication, emotional responsiveness, cognitive style, maladaptive, or, how's this child talking? It's used from 3 to 22 years of age. So you might have, let's say, only one of these tests. These are fairly complete tests. If you do an ADOS or an ADI, those are complete, and you'll probably get a really good diagnosis with those. So let's say you get this diagnosis and you learn that your child has autism. You got to take a deep breath and process this. It's a lot. It hits you hard. So take the time you need. Well, don't take 2 years, but take a little time to process it, okay? Because it's scary stuff. But it's a journey, and you go with it and learn more and try different things, which is what we've done with my son, who's now 17. And then you start doing lots of research. You swing into action. Well, you want to be a little careful here, because you might be on the internet all night long, and there's all types of things, people claiming that they're going to help you with autism, and some of them are really good, and some of the stuff is out to lunch out there. And you have to be a little bit careful what it is you do, because some people are trying to make money and not really help you. You have to be a little careful. So be aware of that when you're looking. And please remember, you get the diagnosis, but your child is still the child you always loved since the day of their birth. They didn't change. How you may be approaching things change, okay? Let your family help you, help each other, and all of that. It's really important. Take care of yourself. So you take a deep breath, you start doing a little bit of networking. You can contact the Autism Treatment Society, or the Autism Society, or Autism Speaks. They're reputable organizations. They're really good foundations. You can contact my Hana here, which you already have done. Good organization. And you don't even have to wait for the official diagnosis to get started on services, because early intervention is important. The earlier, the better. a child mind can change when they're younger. So you can contact your school district if your child is over 3. They have early intervention resources pre-K. Let them know what's going on. You can connect that way. And also you can even go to a clinic and start. I was in OT with my son before his official diagnosis. I went. So it never hurts to get services. I've treated family members, or I've treated, clients, and a patient's patient, the parent might say to me, what if he really doesn't have autism? And I tell them, first of all, therapists don't hurt children, so you might as well get a little bit of help. And if it's not autism, that's good. We're going to still work with them. They might need help with something. So it doesn't hurt. But educate yourself as much as you can. You can network with organizations, do your reading, get your early intervention, get started, and connect with school age services, and talk to other parents. They know. Talk to teachers, talk to your doctor. If you get into a group and it's not a fit, doesn't look like it supports you, you can change. You can do that with your doctors. You can do that with your therapist. You can do that at school. You have rights. So do your children. You get what's a good fit for you. Please keep looking. And it's scary, but it's a journey. So once you start getting over, you do your processing, but don't take a year to process. When you start getting a little busy, it'll help you to deal with it. And take care of yourself so you can take care of your family. And this has been another lovely MyHana. We hope that you've enjoyed it, and hope to see you again. And thank you for watching.